Okay, so welcome everybody to this presentation of a piece of research that both Frank and I have been working on. It comprises one of the papers from Frank's PhD, and we've submitted it to a 3-star journal, and it's currently under review. So we'd really welcome your feedback on the paper and any questions that you might have. So the title of the presentation is "We Found It: The Missing Link in Management Control Systems in Not-for-Profit Organizations." So I'm going to present the early part, setting up the study, outlining the rationale, the motivation for it, the relevant literature, the approach taken, the conceptual framing. And then Frank I'm going to present some of the findings. And then Frank is going to take over and discuss those findings in detail and outline the conclusions we've drawn and the contribution that we think we can make from this study. So the motivation for the paper is the increasing recognition of the role of nonprofit organizations in the provision of health and social services for vulnerable people. Our expertise is also in the area of management control systems, and we're familiar with the kind of research that is going on performance management and management control systems in these kinds of NPOs. We observed that an awareness of stakeholder attributes can assist in understanding performance conflicts and tensions between mission and the attention afforded to stakeholders. And that formed the basis of the first paper from this study, which has been published. So okay, let's leave it at that, and let me move to the literature. Okay, so we're looking at performance of NPOs. That in itself is a complex montage of performances, because there are multiple stakeholders in NPO settings, each with their own individual objectives, and each requiring management of the NPO to respond to them. So in managing performance, management control systems that support management have to be designed and used to reflect the multiple objectives of the different constituencies towards the realization of mission. And so I suppose the key thing underpinning this work is that NPOs have an organizational mission. And that the control systems are designed to deliver on that. The control systems assist them with performance management. Accountability processes are an essential component of management control systems. And we focus quite a bit on accountability and what it means. So the mission realization is undermined, we think, when NPOs focus on being accountable to dominant stakeholders to the detriment of other more mission-centric stakeholders, to the people for whom these organizations were set up. But the other stakeholders, which can be funders, regulators, government, these people, the board of these organizations even, the management attention is limited, and the management attention has to be shared, if you like, among the stakeholders. And so there's this tension really between whose needs are served by management control systems in not-for-profit organizations. And this may be intentionally or probably and most likely unintentionally. I don't seem to be able to move that forward. I'm stuck. 1 second. Okay. And this tension between serving the needs of different stakeholders can be exacerbated in times of crisis. This has already been observed in the literature. Okay, so if I could spend a few minutes talking about accountability. Our view is that accountability is relational in nature, that it the accountability that is delivered by NPO management to various stakeholders is relational in nature. And accountability, when we talk about it in the context of the management of for-profit and not-for-profit organization, it assumes a capacity of the stakeholder to engage. But not all stakeholders have the capacity to engage. And this has ramifications when mission-centric stakeholders in particular have limited capacity or power to represent themselves and to engage with NPO management. But there is a way to address this through advocacy. The advocacy work that has been done in the management control systems literature has tended to focus on external advocacy, on management of NPOs, advocating, seeking additional resources, additional attention, policy making, and so on. But there's been very little work on the role of advocacy within the organization, which we call internal advocacy. Advocacy is important in that it's critical in supporting the visibility and the voice of vulnerable service users, and consequently, achievement of the organizational mission. In times of crisis, the dangers of mission interruption for mission-centric stakeholders can be significant. And the European Disability Forum has already identified this as a concern. So the research approach adopted to examine how do management of NPOs engage in accountability processes with vulnerable mission-centric stakeholders in managing performance. The best approach we felt to answering this question, having reviewed the literature, was a qualitative research approach, engaging with senior and middle NPO management to see what they thought about this relational nature of accountability in not-for-profit organizations. So the approach adopted is an abductive approach to this qualitative case study. Now, the case study, if I could talk about it for a minute, the unit of analysis, we've recognized the needs that it be paradigmatic, because these kinds of cases highlight the more general characteristics of society under examination. And so we looked for organizations that are present in delivering services to vulnerable stakeholders. We reached agreement with 4 organizations to participate in the study, and collectively they represent delivery of services to 14% of, they represent 14% of the budget of services delivered to people with intellectual disabilities. One of the researchers, Frank, had already worked with this sector and had good knowledge of the structure of the sector. Okay, so the data gathering consisted of 2 main elements: document analysis and semi-structured interviews. So 36 semi-structured interviews were conducted with 4 non-for-profit organizations in the intellectual disability sector. Then or prior to that, documents related to governance, accountability processes, management controls in NPO organizations such as these were reviewed. National documents, relevant legislation, and international treaties and commentaries. So our findings then, okay. One of the elements of the research was that we asked the stakeholders, senior and middle management in NPOs, to score the importance of the various stakeholders. The various stakeholders are here on the left-hand side. They're the funder, the regulator in the sector, the board of the NPOs themselves, and the service users. So these are the stakeholders that there's general agreement on in the literature are the key stakeholders in not-for-profit organizations. That there's been a great deal of work done on this by Heinemann and McConville at Queen's. So we asked NPO management to score the importance of these stakeholders to the NPO, with 1 being the highest score. And therefore, the lowest number here represents the most important stakeholder as perceived by NPO management. And you can see here that service users are the most important to NPO management. And this is as it should be because they're central to organizational mission. And the funder and the regulator have relatively equal importance for NPO management, followed then by the board. We asked them also about lots of questions about the importance of the various stakeholders to organizational mission. And again, service users were identified as the most important to organizational mission. That's why the organization was set up in the first place. With the funder and the regulator having moderate to less importance, and the board lesser importance again. Now, when we look at the management control systems, these are here on the left-hand side. We look at them across the across the 4 different stakeholders. The 3 management control systems are the client delivery system, which is focused on each service user within an NPO, the budgeting system, and then the governance system, which we've called the assurance of services, which consists of several different elements. And we look at the management control, we looked at the management control systems to see what reports, what reporting, if you like, there was to the different stakeholders in NPOs using the different systems, the 3 different systems. So for service users, there's a limited accountability to them in the sense that there is at a minimum an annual meeting. There frequently isn't, we've been told in interviews, no evaluation reports in the interim between one annual meeting and the next. There may be a 6-monthly meeting in some instances, but that's not always the case. The regulator receive reports. They're in a position to request reports in advance of inspections and to request one-off reports. The board, whom you remember from the previous slide, ranked lowest, if you like, receive regular reports and receive ad hoc reports, one-off reports as they see necessary. The funder receives limited reports. In terms of the budgeting system, nothing received by the regulator or service users, but the board and the funder receiving regular reports on actual expenditure relative to budget and so on. In terms of assurances of services, everybody receives reports other than the service users. So these are the management control systems used to manage the performance of not-for-profit organization in delivering services to people with intellectual disabilities. In the paper, we've included quite a bit of information from interviews in support of, or in commenting on the need for greater representation of service users and how that might be done. And here I just give you a sample of 3 of these pieces of information from interviews about advocacy activities. So all of the data is coming from managers of NPOs, in the first case, senior manager, who's of the view that service users are largely disempowered in the structure. Middle services manager feels that service users are probably the persons who have the least power, even though the service is built around them. And another middle services manager who believes that there would be a lot of advocacy in their organization, but when we queried the depth and type of advocacy, it was thought to be really lip service, and that it wasn't really a deep kind of advocacy in a meaningful way for service users. Okay, so what we'd like to do is discuss these findings with you, and Frank is going to take over and talk to you about the findings. So I'll stop sharing and Frank will share. We're just doing this so Frank can control his slides himself.
Sorry, that would be handy if I was to unmute. Thank you everybody for being here, and thank you, Geraldine, for that introduction. So what I'm going to do is I'm just going to have just a quick summary recap of some of the points, and then take us through where we have arrived in terms of our discussion and analysis, and maybe paint a picture as to, and hopefully a story that is clear, and where we might be going from here in regard to all of this. So, quick recap. Non-profit organizations, that's our focus here. Multiple constituency construct, which means they've got lots of stakeholders with multiple and differing objectives. Accountable to relevant stakeholders as constituent element of MCS. What we mean by that is that accountability is a critical and important part of the management control systems in non-profit organizations, which systems are there to facilitate management in achieving their mission objectives. So accountability is really important in relation to these stakeholders, and that these accountability processes in non-profit organizations, the literature is telling us that are relational and need to be relational in nature and dialogical in terms of facilitating that two-way street. And therefore, there's an assumption of capacity to engage, as Geraldine pointed out. Accountability to what we term mission-centric service users as stakeholders in these organizations. These are, for instance, in the organizations we're talking about, people with intellectual disabilities, are at the heart of what the organization was set up to achieve in terms of its mission. So the objectives of these stakeholders are actually central to mission. So we regard them as mission-centric stakeholders. Other stakeholders we might regard as stakeholders that provide a means to achieving objectives. Slightly different focus. So, the role of power perceptions. Management regarded service users as the least powerful stakeholder, which is really interesting. What does that mean then, particularly when stakeholders have capacity constraints? They were identified consistently through the interviews and data as having a weak and at times no voice. This has implications when we're talking about an organization that has to provide attention to multiple different stakeholders. So they were the least engaged with by management in terms of accountability as well. So we saw from one of the earlier slides that the formal accountability processes tended to be geared towards the stakeholders that were regarded as more powerful. And in these instances, the stakeholders that are providing means as opposed to being mission-centric as such. So service users least engaged with, while nevertheless being acknowledged as the most important in terms of mission. That itself is just an interesting observation. So the accountability needs of these particular stakeholders, the service users, we found were subordinated to those to whom the organization perceived as more dominant. The requirement to talk to the funder, the requirement to talk to the regulator, and the requirement to be accountable to the board. And because that skews accountability processes away from the mission-centric stakeholder, that has the risk of bringing about mission drift. Information flowing to stakeholders is determined by the power of the parties to demand it. We see this in the literature. So those who can demand will get attention. And what does that mean then for stakeholders in the context of these nonprofit organizations? So we highlighted this absence of accountability to this least powerful yet mission-centric stakeholder. And this finding supports a concept that was touched on there by Geraldine of maybe there's a need for a focus on internal advocacy as a mitigating intervention. So what we saw was that we had evidence of some advocacy. The respondents by and large felt that it was inadequate or inappropriate, and at times, to quote one, was essentially paying lip service to the need, which was interesting. The point then is, if we can focus on internal advocacy, can we in some way address this power deficit, this lack of voice, and therefore have a meaningful, if you want, intervention in relation to the balancing of attention to stakeholders? Interesting, some of the research tells us as well, and this is important in terms of the stakeholders we're talking about here with intellectual disabilities, and what do we mean by their objectives in terms of their quality of life? Participation in life is a key part of that. And we see from some of the literature telling us that accountability is not just an account, but can also be transformational. So when we include people in terms of being accountable to them in a relational and in a dialogical way, that in actual fact, just that process itself can actually be meaningful for the individual and actually go towards in some way achieving their part of their life objectives in terms of being included and being inclusive. So our study, it's supporting the role for extending accountability within the management control systems to incorporate monitoring and reporting of internal advocacy. What we saw was that there was an absence of attention to internal advocacy, and there was no attempt to record those advocacy processes within the management control system, and therefore give attention within the management control systems that would bring attention to management of internal advocacy processes. So again, going back to O'Leary's work, with service users as the active driver with a focus on facilitating and enabling core mission objectives, this would realize part of the requirements for transformative accountability. Basically, we need to include people in these processes as well as identifying them and accounting for them, if you will, within the management control systems. So this internal advocacy, the phrase that we've coined, it's essentially any if you want, policy, action, or requirement in relation to the delivery of service that would facilitate self-advocacy of the service users and or representative advocacy for those service users. When we look at the literature, we look at accountability, the logics of accountability that we find in nonprofit organizations. And this particular slide here, we're just going to go through a few slides to try and represent in a graphical form what we mean by accountability in terms of nonprofit organizations. So over here, we're talking about mission facilitating, right, which are stakeholders, right, that are facilitating the mission by providing means such as funding, regulation, etc., board and direction. And mission-centric stakeholders, those that are central to the mission of the organization. This requires engagement with these stakeholders, which assumes agency on behalf of the stakeholders. underpinned by capacity for self-advocacy. That's the basic assumption of the NPO accountability logics that we see. So this type of perspective on accountability embraces a dialogical and relational accountability design logic, right, incorporated into the management control systems design and use. And that's there to counter mission drift and support mission realization. So we're talking to all of the stakeholders, we're involving them, and we're balancing their objectives towards mission realization. In the organizations we've been examining, the assumption of agency is undermined. So we have accountability to mission facilitating stakeholders, which assumes agency underpinned by relative capacity for self-advocacy. So the funders can advocate, the regulators can advocate, the board of directors can advocate for themselves. They have agency. But the mission-centric stakeholders, this assumed agency is compromised by relative incapacity for self-advocacy, which is very important to recognize. When we come then to the accountability logics, we're looking at a dialogical and relational accountability and agency supportive design logic. What we mean by that is the accountability logic, in order to be effective, must incorporate some means of supporting the agency of the stakeholder that has a compromised capacity. And only through that then will you have effective accountability within the management control systems to ensure that we balance the objectives of all stakeholders and achieve mission without mission drift. So this is an advance that we've articulated of the previous accountability logic model for nonprofit organizations, recognizing this particular aspect in terms of agency. So moving away from just focusing on accountability to the overall, and what we're trying to capture here is a description of the overall performance management model for nonprofit organizations that are providing services for service users, in this instance, for these stakeholders that have potentially compromised agency through limited ability for advocacy. So really what we're talking about here is that we have mission service and delivery, and that's designed, and it is managed through performance management practices, part of which are management control systems and accountability, which we've just been referencing. And when we unpackage management control systems and accountability, what are the elements within there that we need to see in order for management control systems and accountability to be effective? Well, it must be informed, it must be mission informed. So it has to be informed through the mission of the organization and strategic objectives. Because these organizations have multiple stakeholders with differing objectives, identification of the relevant stakeholders is critically important in order for management to be able to account appropriately to them and incorporate their objectives. Identification of communication and reporting lines. And all of this over here to the right gives rise to a flow, if you will. Nonprofit organization performance requires us to incorporate and identify the multiple constituencies of stakeholders. That means a dialogical relational accountability, which means that stakeholders necessarily need agency, and in order for that agency, we need to have internal advocacy practices. And through the internal advocacy practices, we can enhance stakeholder agency and therefore bring around transformative accountability, helping us to realize mission. And of course, this continuously feeds back to monitor and improve the overall management of performance. So critical to this in our work was the identification of the absence of internal advocacy practices being captured by the management control systems within the organizations we looked at. And we're suggesting that because of this absence, it's going to potentially undermine the ability of the organization to fully achieve mission, and that there might be mission drift because of the lack of attention to these particular stakeholders. Will the organization really achieve the objectives of these stakeholders? So, a little bit about crisis. So the study was set in pre-COVID times, but what has been really interesting, we went and we did a retro look over the last year and a half through COVID and what was happening in this domain. And what was interesting was that the pandemic brought a recognition of the critical importance of advocacy for vulnerable service users across not just disability services, but services for the elderly and so forth. So it drew critical attention. Drawing critical attention of civil society organisations like the European Disability Forum referenced earlier, other human rights organisations, and other European organisations, focusing on the difficulty that service users encountered as a result of an absence of advocacy within the organisations, which chimes with the findings of our study. So these commentaries and critical reports supported the need for internal advocacy mechanisms and practices. So the study points to an opportunity highlighted by this crisis to learn and to add to our research indeed and move the agenda forward. So conclusions. The work identifies stakeholder voice as central to accountability process. So, and we set out a development of NPO accountability design logics, incorporating the recognition of agency supportive elements within the design logic. Reinforces this outcomes and of this work reinforces the identification of the voice of mission-centric stakeholders, and critically the mediating instrument, internal advocacy, being incorporated into the management control systems and performance management systems. And we suggest a performance management model that we've just gone through that identifies that. Management deliberately facilitating enhanced relational accountability can potentially have transformative effects for organization mission realization. And again, simply put, if we engage with stakeholders and we do so in a relational and dialogical way, and if part of the objectives of those stakeholders is to enhance their inclusivity in society, then by so doing, we're working some way towards actually achieving mission drift in that particular small way. Internal advocacy in mitigating compounding negative impacts when the external crisis hits. And we have our external crisis continuing. It may not be the last. So when you have an exogenous crisis, when you have something imposed that seriously brings the attention of management in particular directions, necessarily, this study and the evidence from the pandemic in the domain of disability services points up the potential for internal advocacy in mitigating compounding negative impacts of the crisis, such as the imposed lockdowns, which cause people to be separated from advocates they would normally have, family and other carers outside of organizations or outside of services, were suddenly absent and not present for the individual. Thank you for listening to us, and I think we're going to open up for some Q&A. So I'm just going to stop sharing, and I'm back to the room. So we have the Q&A facility. Sorry, Gerda?
Yeah, there's one question there, Frank, from somebody saying, would you then say that an internal advocacy strategy should be part of the overall evaluation of efficacy of these NPOs? Yes,
that's essentially a core to what we're saying, is that the internal advocacy, there should be, I think the use of the term strategy in that question is actually quite good, because it would be suggestive that there should be some form of organizational strategy to underpin internal advocacy, and that would be part of the evaluation of the performance of the organization. And to do that, we're suggesting is to incorporate that within the management control systems, so that when management are receiving reports, part of the reports of the that they're looking at, that's informing them as to how the organization is doing, would incorporate reports about the internal advocacy functions and what's happening, or indeed what is not happening.
Okay, and the last part of that question was, so that does the emphasis shift then from the means to realizing the mission? And I think that's what we've been saying, that at the moment the accountability process are very much skewed towards the facilitating stakeholders like the funder, those responsible for governance and so on, but there can be an overfocus on those who provide the means to realization of mission without sufficient focus on those who are central to mission.
Yes. I see a question there. Also interested to see how this can be integrated into funding decisions. Yeah, I think where that may happen, or might be there might be capacity for that to occur, is in rebalancing the attention within the organization that incorporates now more attention towards this internal advocacy. That the objectives of these mission-centric stakeholders may become clearer, and in that regard, that clarity will inform funding decisions and funding proposals. These organizations will typically be putting together regular proposals to the funder in order to meet what they feel are the type of activities they need to engage in to support service users. But what we're suggesting is that with an enhanced voice for these particular stakeholders, for the service users, that those funding proposals should shift and align more towards the objectives of the mission-centric stakeholder. I hope that makes some sense.
We'd welcome any more questions. We'd welcome more questions if you would raise your hand, maybe, and we can then facilitate or allow you to speak. Okay, so we have a question actually from Emer. Are you unmuted, Emer?
Okay, now I think I'm unmuted.
Excellent.
Okay, sorry, I was busy there typing away, trying to get, but it's much easier if I can talk to you directly. Thank you very much for the presentation. It really is very interesting in terms of how the management control systems are not essentially supporting the vulnerable stakeholders. What I find interesting is really the role of the board, at least in a charity context. And I'm not sure if all your NGOs are kind of registered charities or not, or whether there are different organizational structures. But my understanding of the role of a board of a charity is that their job is to supervise the delivery of the mission. And I think that raises the question that if the vulnerable stakeholders are not being heard, number one, the board aren't doing their job, in which case your suggestions around management control systems which draw attention to this is an excellent one. I think that is really an excellent one. The other thing I wondered about is greater representation for advocates for the vulnerable stakeholders on the boards. Mm-hmm. And could changes in the composition of the board, create a louder voice for the vulnerable stakeholders?
I think that's a really interesting point, and it kind of chimes a little bit with we have a question here in the Q&A. Might there be a duty under the Assisted Decision-Making Capacity Act that the will and preferences of users be amplified beyond internal reporting? I'm thinking of social care approaches such as co-productions, which actively involve users in service design and delivery. So just taking, Emer, what you said, and that, and I might try and make hopefully clear, but maybe end up in an overly complex observation or answer. I think in relation to board representation, we have found for organizations that can default to difficult situations where there is a lack of recognition of the capacity of certain stakeholders, and then a lack of recognition of the fact that they can actually actively participate at that level. I do think in that context, the Assisted Decision-Making Act, which is yet to be fully commenced, we're still waiting on that, will actually bring in and facilitate a means through which we should see more people with intellectual disabilities and capacity constraints generally being involved in their own support services, being involved in their own lives and decision-making to a much greater extent. So I would see the possibility of down the road greater representation at board level. And then in terms of will the will and preferences of the users be amplified beyond internal reporting? I'd like to think so, yes. And the social care approaches such as co-production is certainly where I think if we're looking at a rights-based capacity recognition approach to people generally, then that's where I think we will see things going. One hopes. So in terms of co-production, that will require recognition that individuals may need assistance in terms of their agency through facilitating self-advocacy or even representational advocacy. And yeah, that has implications in terms of the assisted decision making. A bit rambling, sorry, but I hope that might have addressed the points.
Yeah, it's really helpful, Frank. And I think it's worth looking at, when you're talking about moving from internal reporting to external kind of advocacy, for that advocacy to get kind of airtime in the public. I mean, it's interesting to think that we haven't commenced the SORP for charities in this country. And again, the SORP really does bring substantial additional reporting. So, I think there are ways to improve our regulatory arrangements around external reporting. So that at least I think the value of internal management control systems is it puts it on board agenda. The value of external reporting requirements is it means that they have to be accountable for it. And so I think both sides of that need to be furthered. Okay, yeah. I'll stop talking now.
No, I think it's an important point, the external reporting, and I think we will see, I think, evolutions in terms of the regulation and oversight of social care in this jurisdiction in Ireland. At the moment, that's been overseen by HICWA in relation to looking at different social care models that might evolve and how then they should be regulated is a discussion that's going to be happening in the near future. So there's the financial reporting, the SORP, as you point out, Emer, and then there could be other requirements and regulations which should enhance. But I think one of the things that we're keen to focus on in our work is kind of like a simple story. If we identify that internal advocacy is important in order to ensure that there's an appropriate balance of recognition of the different stakeholders within the organization towards achievement of mission, then we need to be cognizant of that which is counted, that which is reported, is that is what will get the attention. And that at the moment we do not see that happening, and we're looking to see. I suppose it might be just if I was to articulate where we would view going forward from here. Our research has identified this particular, if you want, gap within MCS and performance management. What we haven't identified are what are effective advocacy processes and interventions internal to organizations. What would they look like? And how might those types of activities be captured and reported on? And more importantly, how might we look to see the manner in which they're either effective or not? So that's for future research. And the plan would be to take this further and to move back out into the field and start those conversations and start looking at what the actual mechanisms for supporting agency through advocacy interventions internal to organizations, what might they look like in reality, and how might they be captured and reported on? Because that would be critical to advancing what we've just been talking about, to incorporate them then into MCS. So that's just give you a sense of where we feel we need to go to build on what we've identified so far.
Can I just add there that the people interviewed in this study, who are the people delivering services to people in the sector, they identified these mechanisms themselves. There's an openness to engaging with relational and dialogical accountability. And while I think I hear what people are saying in terms of reporting externally and so on, I think what is required is to get this relational accountability going with service users to increase their sense of value or importance or whatever to the organization.
just another question in there. I see. Does your analysis assume that people whom the NPOs serve have rights to demand services in the context of shrinking space of welfare state? Do ordinary citizens have any rights to demand those services from private charities? Any comparisons of your study or any thoughts in the context of the developing countries? Well, we haven't moved to comparisons within the developing countries. But in terms of your right to demand services, in that context, we are really, it's very interesting to map the evolution of this space in terms of where we see the discussion around people's rights in that regard. Historically, we have, and unfortunately currently to some extent, we still have a focus on a medical model of support, which can be also, have a charitable type of sense to it. So it is delivered as a charity as opposed to a right. But that has evolved and has changed. And we do have international conventions. We do have conventions at UN level. We have in terms of disability, we have the UN Convention on the Rights of People with Disabilities, which is legally enacted, are legally recognized in the European Union and now in this country. So there are mechanisms where we see rights have evolved to garnering, if you want, a legal basis for actually requesting that those rights are upheld and recognized. And that extends then to the basic supports and services that are required in order to recognize and to realize rights for people. So again, this is something that is evolving and the discussion continues, but I hope that might answer it in terms of your question. In relation to developing countries, I don't have a perspective on that, so I wouldn't comment to that at the moment.
I just might come in there and say, I think that people who are served by not-profit organizations have an expectation of, services that might be delivered to them in the same way that our students have an expectation when they come to university, that it's not just about lecturing and teaching, and that there's a whole other personal development through societies and clubs and all of that. So I think it's the voice, the increased voice of the service user is what we're drawing attention to the need for in not-for-profit organizations. And how do you get that increased voice when people are compromised? You get it through some kind of relational and dialogical accountability mechanisms. I'm not sure exactly what, if they involve the wider network of the service user, perhaps the family and support system and so on.
Yeah.
And thank you for the question.
Thanks, Sarah. I think we had Orla. Orla, you had your hand up.
Okay.
So I just have to.
Hi, I don't know, can you hear me?
Yeah.
Hi, Orla.
Hi, Frank. Hi, Darlene. Thanks very much. I actually just typed it in, a question into the box. It was the same question, but it's actually easier to chat through it. Thanks very much. It was really, really interesting paper. I loved a couple of terms you referred to, things like mission drift. I think it's a really nice kind of a label for what's probably happening in these organizations. You sort of more or less answered my question a few minutes ago, Frank, but I said I'd ask anyway, just to see, do you have any sense to this? I think the future research question really here is, what exactly are these internal advocacy mechanisms going to look like in practice? How might we actually put these mechanisms in place? But have you any sense at the moment as to, what kind of practices might work? Geraldine, you just mentioned there, maybe the need to bring in the wider network of service user into the conversation, or did you get a sense of any of these practices that are taking place at the moment, Frank? I mean, clearly they're not going on a whole lot, but is there any level of internal advocacy taking place at the moment?
Yeah, I think there's two aspects to some of the findings in relation to advocacy practices within the organization. By and large, the advocacy practices that we found tended to be of the nature of having sometimes what might be termed as an advocacy council within the organization, and that would be facilitated to to meet and discuss issues for stakeholders. Interestingly, within some of the organizations that had that, they also identified that it's happening, but is it actually being listened to? And the inference was not particularly. And then you can have advocacy at an individual level as opposed to an advocacy council. So you'd be looking at advocacy mechanisms associated with individuals in terms of their individual interactions and relations with the NPO. You know, that's somewhat more difficult. And I think when I suggested earlier that what we need to do now, and that would be the plan, is to get back out into the field, and particularly in the context of the assisted decision-making capacity legislation, which I expect will be commenced. Everything has been delayed because of the pandemic, but I expect will be commenced within the next, I would hope, 2 years or so. We'll see. It's been a while. It was enacted in 2015. That would be somewhat of a game changer in terms of requirements to recognize that there is an assumed capacity as opposed to assumed incapacity for individuals. And it'll be interesting to see how that, or what difference that will make for individuals in terms of the relations with NPOs and service providers. But it's going to require getting into the field. I don't have any answer in relation to what specifically might or may not work, or what the processes or procedures might be in terms of accountability, relational accountability or dialogical accountability processes in that context. I think that's something that we have to discover.
Okay, so thank you. Thank you very much. Lovely. Thank you.
I see a question here from in the chat box. Might there not be a principal agent problem of sorts in internal advocacy between the user and advocate? Whoever pays the piper, an internal advocate would have a potential conflict of interest. Yeah, it's an interesting point, and even in medical literature, that has been identified sometimes as an issue in terms of that. Jordan, do you want to come in on that?
Yeah, could I just come in on that? And because it relates to Orla's question as well. I think we already have some advocacy in the one meeting that takes place annually with the service user, and that typically is with the family or the people supporting the service user. But that's to lay out, you know, what you'd like to get from the service for the next 365 days. But there's no reason why that kind of meeting couldn't be extended to, you know, to be bi-monthly even, or something like that, to review the, you know, achievement of the service users' objectives for living, if you like, during that time. So there is where a service user doesn't have a network, a support network, and there's a need to rely then on people within the NPO organization. There may possibly be a conflict between principal and agent in that sense, you know.
Yeah, and I think what we would look to in that regard is to try and see what may or may not work. As we know, with principal agent issues, agency interventions can work and can be dysfunctional. So what might there be? And again, I think we've got interesting times coming up. If we have the assisted decision-making capacity legislation commenced, it imposes a requirement that we recognize capacity, and we recognize that individuals can represent themselves, and or if need, can have and should have assistance in that regard, which would not necessarily be from within the organization. But what we'd be looking to see is, to what extent does the organization facilitate that in terms of their engagement with the service user, and actually capture what it means in terms of being accountable.
Okay, well, I think there's another comment in there from somebody with experience in the space saying that internal advocates are highly vulnerable to co-option or to tick boxing and being ignored in their experience. And I agree, possibly, if you don't have a support infrastructure advocate. Yeah,
I think these are all going. These are going to be
That's a risk.
really interesting questions, and it's a very good question for when we get into the field again to
Yes.
to try and to start unpackaging this.
Yeah.
I think they're really important points.
Yeah.
Thank you.
Thank you, everybody. Are there any more questions?
I don't think so, Geraldine.
Okay, no hands up.
Okay.
Okay. I think that's been very helpful, everybody. I thank you all for giving of your time and attending. I hope you got something from it. We certainly did. It's been really useful for us to have those comments and those questions and that feedback. Thank you.
I must echo that. Thank you very much for giving of your time, for being here and asking us the questions. I think that will all build for the future, and I look forward to being able to see everybody in a room the next time we present. It will be good. But let's recognise that these webinars online do still provide us with these wonderful facilities to be able to communicate with our colleagues and our stakeholders in terms of the research we do. So thank you for listening.
And thank you to all. Yeah, thank you.